This presentation will focus on the multifaceted problem of gang affiliation amongst youth. This is a multifaceted psychosocial problem that entails developmental, neuropsychological, clinical, as well as social psychological determinants. Interventions will focus on tailored social programs, psychotherapeutic clinical interventions, anti-bullying programs, as well as developmentally focused interventions, specifically those that seek to improve the quality of parent-child attachment. To focus on the problem in its fullest scope, this is a problem that has a significant strain on the American economy, costing us $215 billion annually, specifically imposing a strain on communities which are already economically and socially disadvantaged. 2 out of 5 total gang members in the country are under the age of 18. 8% of all American youth 12 to 17 are involved in gangs. And we've seen in the news, even currently here in New York City, 16-year-olds on the streets of East Harlem involved in gang wars, killing innocent bystanders. This leads to cumulative disadvantage, leading to increased risk of mental illness throughout the lifespan due to trauma, anxiety, psychosis, depression, lack of access to educational employment opportunities throughout the lifespan, increased risk of not only committing violent crime but becoming victims of violent crime themselves, involvement in illicit activities, aggression, intergang conflict, toxic masculinity, all part of routine activities theory, positing that just being involved in gangs exposes gang members to increased violence. Now, not all gang members necessarily show the same trajectory of becoming involved. In reality, many gang members do show sort of neuropsychological distress in childhood throughout the lifespan. So when we talk about those determinants, those will be the life course persistent offenders. Moffat posits that you have those offenders that show that history of neuropsychological distress as children. The kids that have ADD, ADHD, learning attentional behavioral disorders. It's a lifetime trajectory of distress that will persist into adulthood. When we focus more on sort of social determinants, those social determinants in adolescence, the need for belonging, the identity formation, etc., adolescents, limited offenders. They want to belong, they want to question authority, look to be cool. They don't exhibit those developmental disadvantages, those neuropsychological disorders. Those will be the offenders that will not necessarily exhibit deviance throughout the lifespan. Now, we look into the individual factors. We look at personality trait theory, innate, stable, enduring aspects of one's thoughts, behavior throughout the lifespan. The most accepted model is the 5-factor model. We look at these 5 factors: ocean, openness, conscientiousness, extroversion, agreeableness, neuroticism. Gang members tend to exhibit some common personality traits. They're low in agreeableness, conscientiousness, high in neuroticism, increased aggression, increased mental distress, antisocial behavior. Gang members will tend to have an increased diagnosis of antisocial personality disorder, lower empathy, lower emotional intelligence. The gang leaders will be highly self-confident, dominant, assertive, increased narcissism, exaggerated sense of self-worth. Psychopathy comes along with this, greater impulsivity, moral disengagement. We're going to now look at some developmental factors. So attachment theory, Bowlby looked at John Bowlby, the quality of bonds between infants, the primary caregiver, could be predictive of the nature of later interpersonal relationships. When you have secure attachment between the child and the parent, generally autonomy, stable, firm relationships. Poor attachment, avoidant, anxious, disorganized, you have greater distress, later failure to show affection or concern for others. Again, qualities associated with gang members. Aggressive, delinquent behavior. When the child has an insecure attachment style, they're going to be more vulnerable to join gangs. And DeVito says that when secure attachments with the parent is lacking, the adolescent will then utilize the gang to sort of fulfill that need for safety and belonging. The gang will function as a surrogate family unit. Neuropsychology shows us that Neuropsychological findings shows us that when we look at adolescence in general, this is a period associated with greater risk-taking behavior. There's a maturational imbalance. The social, emotional, and self-regulation systems develop at different rates. So in adolescence, there's peak sensation seeking. The self-regulation abilities are underdeveloped. The prefrontal cortex, which is implicit in reasoning and impulse control, is underdeveloped. The limbic system, which is implicit in seeking reward, risk-taking, and peer acceptance, is developed. So this is why adolescents are very vulnerable to do things like joining gangs and to do things like seeking, acceptance among their peers. Adolescents are also very vulnerable to the onset of mood disorders. There's increased prefrontal cortex plasticity, there's synaptic pruning, and when youth do not have access to mental health services, inadequate parental support and attachment, adolescents that are at risk of mental illness, depression, bipolar, etc., they'll seek relief from within the gang unit. Another interesting finding is that when youth live in communities where there is high exposure to violence, communities where there's high gang activity, the amygdala reactivity will be increased. And this leads to reductions in gray matter in the prefrontal cortex and hippocampus, again resulting in that impaired judgment, reduced intelligence, poor academic performance. And without the support of strong parental relationships, community institutions, etc., there's increased vulnerability to gang affiliation. Another factor is teratogenic exposure in utero. Drugs, alcohol, tobacco, pollution, poor nutrition, lack of folic acid. Also, if the mother, the pregnant mother, takes SSRIs due to mental illness, depression, etc., there's an increased risk of behavioral and learning disorders, including ADHD, oppositional defiant disorder, conduct disorder, which are associated with greater incidences of antisocial personality disorder, impulsivity, aggression, and deviance in adolescence, all associated with gang activity and affiliation. The behaviors associated with ADHD, impulsivity, hyperactivity, and attentive behaviors, they make it difficult for youth to empathize with others. They make friendships very difficult. Such youth experience isolation from their peers, rejection, again, increasing susceptibility to gang affiliation. Youth gangs have a very disproportionately high number of members with ADHD. Now turning to social factors. So we look at psychosocial development. Erik Erikson understood that the outcome, the psychosocial developmental outcome in adolescence is going to be identity versus role confusion. Adolescents seek to construct a unique sense of identity. They are seeking a social environment where they can belong and create meaningful relationships with others. And where the space to do that, to safely explore identity without feeling a sense of pressure to conform, where that does not exist, there can be a sense of insecurity, confusion, and rebellion. Adolescents will feel unsure about their place in the world, uncertain about their values, aimless about future directions. And where that void exists, the gang will fill in the void. The gang provides a sense of firm identity, a sense of purpose and belonging, a cohesive sense of values. And the gang also provides a sense of culture and external identifiers. There's a language, there's an attire, there are codes, mannerisms, etc., that are innately tied to identity itself. Closely related to this, we could look at social identity theory. So when we look at self-concept formation, membership in social groups will contribute to the individual's self-concept. And the groups that an individual belongs to are an important sense of they contribute very strongly to the individual's sense of self-esteem. When an individual engages in social identification, they adopt a group identity. They see themselves in terms of that group's norms, beliefs, and values, and they conform to what a good member of that group ought to behave and think like. So a good gang member will do what a good member of that gang ought to do. And then they engage in social comparison, leading to in-group versus out-group comparisons, sort of us versus them thinking. And for rival gangs to bolster the self-esteem of their respective members, they will compete for identities and resources. They dehumanize the outgroup. So in other words, this is how you sort of get inter-gang violence. They defend their gang from the other gang, and this makes the members of that gang feel good when they depersonalize members of the other gang. It bolsters their sense of self-identity in terms of the group identity, and they sort of see themselves in terms of prototypes rather even than individuals. So this very strongly creates a sense of firm identification with the gang unit, increasing identification with the gang itself, and that's why it's very, very difficult to sort of extirpate gang members once that identity becomes very firmly entrenched. Another social factor that could explain why in many communities youth will identify with gangs is social learning theory. So Bandura, right? Bandura very famously had the experiment with the Bobo doll, right? The child sees the Bobo doll being punched, he'll repeat the behavior, right? So the monkey see, monkey do. So Bandura argued that people will observe, model, and imitate the behaviors, attitudes, and emotional responses of others. And when they see behaviors as rewarded in the social learning environment, they're going to imitate and repeat them, sort of observational learning. And in communities where gang membership is sort of rewarded, it's seen as honorable, it offers safety, prosperity, the bling, you know, it's seen as a good thing. You know, when kids observe these behaviors, they will imitate them, often out of necessity and survival needs, right? You know, they'll see gang members treated with respect. They will not be beat up. They will have cars and the things that they need to survive. So the culture of such communities, the necessities of daily life, including protection, making ends meet through whatever means necessary, will render the gang members as being models, and children learn to replicate their behaviors through observation. So because gang members are life models and are like the observers in terms of upbringing and demographics, they become the objects of identification, and the behaviors seem relevant and attainable. Another factor to look at is social comparison theory. So Festinger said that people compare themselves to others. They evaluate abilities and attitudes relative to those judged to be better off, an upward social comparison, which we now believe is not something that will promote a sense of inferiority and reduce self-esteem, but rather it evokes an assimilation effect. We believe that to now be the case, that it will inspire onlookers to aspire to the status perceived to be held by those better off than themselves. So in communities, you know, the youth will engage in an upward social comparison, evoking an assimilation effect, looking at gang members who are better off. So youth would rather be a gang member than than be a victim of crime. They see the gang members as tough, autonomous, rather than being victims or deprived. So this evokes an upward social comparison, inspiring people to join gangs. If we also look at the nature of social disorganization and cumulative disadvantage in communities where gang activity is prevalent, we look at Hershey's social control theory. So in these communities, individuals do not necessarily feel bonded or committed to societal institutions, the typical institutions that maintain a sense of order. The family, the houses of worship, the schools, the police, etc. There's no bonding between individuals in these institutions due to chaos. And they don't maintain order. They cannot be trusted, and that's often due to systemic factors. Systemic racism and other factors. They do not offer the opportunity to allow for advancement through pro-social means and so forth. There's a lack of trust. So the gang fulfills that void. It offers the means by which societal needs that remain unfulfilled in such communities are met, bypassing the individual bond with societal institutions that ought to promote order by fulfilling those fundamental human needs. Economic destabilization results in the collapse of traditional social institutions in these communities that would otherwise deter deviance. We see multiple marginalizations in these communities, eroding any sense of connection to institutions that are failing to meet needs for safety and belonging. Poverty, lack of resources, community stress are all factors that the gang will seek to fill the void in. Now, if we look at interventions, so interventions generally will be targeted um, at looking at these various factors. So we'll have interventions that will look at societal needs, developmental needs, etc. Now, one of the most effective interventions will look at bullying. So Shelley and White found that bully victims actually exhibit the highest levels of risk of joining gangs. Um, because again, gangs offer protection, right? The victims of bullying will be those who engage in social comparison. They engage in social learning, and they see that the gang could offer protection. Through social, we see through Hershey's theory, the school may not offer protection, but the gang can. So what we need to see is that where the school or the police don't offer support, they really do need to. School-based anti-bullying interventions have to be culturally competent. They have to offer protection to students in a way that's age-appropriate, culturally competent to the needs of the environment. Very often, middle school teachers, where bullying becomes most prescient, they need to improve training to have support for students. And one successful program would be a peer support intervention where teachers support students. Students receive guidance from teachers in offering programs where students are helping students. We look developmentally, we have to improve attachment. There are two programs, child-parent psychotherapy attachment and biobehavioral catch-up. These are programs that help improve attachment in early childhood and beyond. We know that by improving attachment between parents and children, this results in less impulsivity, greater empathy, more social competence, more pro-social tendencies in children, which can intercept gang affiliation. CBT, cognitive behavioral therapy, very effective. This reduces cognitive distortions, poor self-control, aggression, external locus of control, a fatalistic worldview, distorted moral reasoning, teaches young people how to engage in critical thinking, problem solving, life skills development, goal setting, moral reasoning, all of which are very helpful in helping young people deal with problematic scenarios. Such therapy also helps children utilize these cognitive processes to reduce antisocial behavior, in increasing prosocial behavior, disrupting problematic behavioral pathways, decreasing the likelihood of engaging in gang activity. Functional family therapy, again, focusing on the family unit, reducing those risk behaviors, deterring at-risk youth from joining gangs by seeking relief within the family unit. Looking at the family as an individual unit, improving self-esteem and peer relations, school outcomes, helping parents function better, helping the family unit function better, to reframe family problems as positive intentions, building on the foundations of a strong therapeutic alliance to change problematic behaviors within the family unit. Looking at the culture, right, we see the gangster rap culture glorifying violence. Well, we've seen effectively that this could sort of be turned on its head. That we could use hip hop as a way to promote pro-social messaging, discouraging gang activity. Mentoring is very effective. Recreational activities, arts, sports, age-appropriate, culturally relevant, free programs that offer supervision, strong supervision to kids, teaching life skills, safety, teaching kids how to make decisions, improving academic performance, decision making, all future life skills to help kids succeed in life. Very effective, especially when former gang members are involved. And lastly, opportunities provision, giving kids the tools necessary to make a living, even when academics are not a strong suit. Helping kids make a living in a dignified, culturally relevant way. So these are some of the interventions. Thank you.